Hi, my name is Alex Bonnel. I'm an academic hospitalist at the University of Pennsylvania, and I joined MedGlobal on their trip to Yemen in November 2019. When I think back to that trip, which our mission as part of that group was to perform ultrasound education for Yemeni physicians, I think back to the Yemeni physicians being extremely driven and interested in what we're teaching and having a strong desire to learn and advance their practice, which was really inspiring as an educator. And B, what stood out to me most was just the obvious lack of resources, which, like many other global health locations, Yemen struggles with having basic access to resources such as hand sanitizers, soap, simple things in their ICUs. For example, I remember they had an ICU that had about 10 beds and only about one bar of soap that every doctor shared and used together. And this was pre-pandemic period, so I can't imagine how rough it must be now when you're trying to ward off COVID-19 spread. So I walked away from Yemen thinking about how much potential these physicians had in terms of when you have a group that's driven, there's a clear way to bring in education resources for them, but also how much of a challenge they were facing in terms of the barriers to basic hygiene practices that really limited the quality of medical services that they could provide, because we could do all the ultrasound education we wanted, but at the end of the day, if the ultrasound device we're bringing in isn't sterilized properly between patients, it's a high-risk fomite that spreads disease to patients being cared for in the ICUs there. So I think the ongoing work that MedGlobal is doing is really inspirational and honorable, and I think that we should continue to provide Yemen with resources, both educational and actual medical supplies, to help them in their practice.